So, good morning, everyone. Here I introduce someone who doesn't need any introduction, but and so we welcome the ever vivacious, compassionate, and wisest Nupur, Dr. Nupur, in our show. She'll be speaking about mental health issues and remedies, and we look forward to host you, and we look forward to learn from you. So, over to you, Nupur ma'am.
Thank you very much, Ria, and good morning, everyone. Thank you, Ria, for giving such a beautiful introduction. And Ria, today I will be speaking about mental health, which is my topic. And most of the time, people are suffering from different issues of mental issues, which even they also don't realize that they are suffering from some kind of mental problem, right? So with this note, I will take you to slideshow, and with that, with the help of those slides, I would like to explain what is mental health, what are the issues, and how you can know about whether you are suffering or your loved ones are suffering from some of the symptoms. Not, of course, not all the symptoms will be there, but some symptoms are there, and they can, go to professionals to take some help and get rid of, or at least take care of themselves, and at least consult and get medicines or whatever remedies they are telling, they can always use that. So first of all, I will explain about everything, and then I will tell, and it might go a little longer, but I will, because such a wide topic that everything can't be covered, but still I have tried to cover it up so that you can understand better what is mental health is all about, because people are not aware of mental issues that they are facing, like anxiety, like many other problems. They are facing emotional disturbances due to some situations or something. And there is one offline program also coming up on anxiety and awesomeness also, which will help you to come out of that. But first we will talk about mental health. So let's start. Let me share the screen. I hope you can see the screen.
Everyone can see the screen? I think we...
Yes, we can, ma'am.
Oh, I have gone back. 1 minute.
Okay, ma'am.
I came to thank you, actually.
Gratitude is very important in life. Good to begin with a thank you.
So that is what I tried to fix it up, but I think so. I'm a little, you can say, still sleepy. So let me take back my slide to good morning, everyone, and start this thing. So we all suffer from some mental issues or other, and mental health is very, very important. So let's move on. First of all, what is mental health? Mental health is also, they are also known as health disorders or conditions, and encompasses a range of disturbances that affect an individual's thought, emotions, behaviors, and overall well-being. These issues can vary in severity and impact, and they may interfere with daily life relationship and functioning. So there are different mental issues. For example, anxiety disorders, which is very much common, which includes anxiety disorders, panic disorders, social anxiety disorders, and specific phobias. Then there are mood disorders, including major depressive disorder, bipolar disorder, and seasonal affective disorder. Then schizophrenia spectrum disorder. It is not simply schizophrenia. It has different types of schizophrenia, which is characterized by distorted thoughts, perceptions, and behavior. A person can hallucinate. They can think that they are in different world. Then there are personality disorders like borderline personality disorder, narcissistic personality, where person thinks that I am very beautiful, I'm very good, and he feels that he is the best. Of course, it should be, you should be best, but over, and it is, if it is more than normal, then it is called narcissistic personality disorder. Then comes antisocial personality. As you know, criminals are, of course, diagnosed with this kind of disorder. Eating disorders such as anorexia nervosa, where many children, many teenagers, they suffer from this. They don't eat much and they go thin and thin. Then bulimia nervosa, binge eating disorder. Binge eating is very common nowadays. Then substance use disorder, when they use drugs or alcohol, that impacts mental and physical health. Then comes PTSD. And here also, when a person is exposed to traumatic events, he will have some of the distressing symptoms. Then obsessive compulsive disorder, very common, and most of us do suffer at some time or other from this kind of, when it this disorder, when we keep on doing one thing again and again, like washing the hand or rubbing your hand, that is all obsessive compulsive disorder. They don't know, but they keep on doing that. ADHD is very common nowadays, characterized by difficulty in focusing, and they are very impulsive. And most of the children, they are suffering from ADHD. Autism spectrum disorder affects social communication and behavior pattern. This is also nowadays very common amongst children. Then there are phobias. You must have seen about the intense fears of specific objects, situations, or activities. When it starts affecting your daily life, then yes, it is a problem. Depersonalization or derealization disorder, feeling detached from oneself or the surrounding. This is also common because many children are alone, many people are living alone, they suffer from this kind of disorder. And dissociative identity disorder, when presence of many personalities in your one individual. This is also very common, and many people don't realize, even their loved ones also don't realize that they are going through this kind of disorder. Then hoarding disorder, when people hoard things, difficulty in parting with possessions leading to cluttered living spaces. And yes, I and most of the housewives, they suffer from this problem. They are unable to part with their possessions. But when it becomes a big thing, that if something is taken away and you fear, you suffer from different disorders, then it is a problem. Then body dysmorphic disorder, excessive focus on perceived flaws in physical appearance. When somebody is thinking my face is not looking good or my eyes are small, something like this, when they feel that this is thing, and actually it is not there. Somatic symptom disorder, experiencing physical symptoms without any medical cause. Then sleep disorder, insomnia, which is very, very common. Sleep apnea, where people snore, and restless legs, when the person is shaking their leg. Adjustment disorder is also there. Then mood dysregulation disorder, common in children. Disruptive mood dysregulation disorder, which is very, very common nowadays, characterized by severe temper outbursts. Then gender dysphoria is their distress experienced due to mismatch between one's gender identity and sex at the birth. Then there's hair pulling disorder, compulsive hair pulling resulting in hair loss. This is also very, very common. Then there's skin picking. This is also very common. Then intermittent explosive disorder, when a person gets episodes of impulsive outbursts of anger or aggression. This is also nowadays very, very common. I keep hearing children are having this problem, or adult children are also facing this problem. Then avoidant restrictive food intake disorder. This is also very, very common. Limited food intake due to sensory sensitivities or avoidance. Then there are other specified and unspecified disorder conditions that do not meet specific criteria for established disorders, but still cause distress and impairment. For this, you have to get your diagnosis done and from the health professionals. Now, what are the symptoms? So many symptoms are there, right? So let's talk about symptoms. Maybe you might be having some symptoms or many symptoms. So there, how do we know that the person is suffering from some mental problem or not? So persistent sadness or low mood feeling, sad, very sad. Then anxiety and excessive worry, changes in sleep pattern, changes in appetite, fatigue and low energy. Most of the people are suffering from long COVID. They are also suffering from these, most of the symptoms that is there, because they are unable to come out of that feeling. Difficulty in concentration, withdrawal symptoms are there. They won't go for any social interactions. Irritability or agitation, that is also there in most of the household. One member or other are suffering from this. Physical ailment, frequent headaches or anything which is not explained. Some physical symptoms are there, that is also there. Lack of interest, mood swings, hopelessness, impaired functioning. Substance abuse is very, very common. They won't take any drug, but alcohol is very common. Drugs are common where it is available, and other substances, that is some cough syrup or something like sleeping pills or mood enhancing pills, something like this. This is substance abuse, which is also very common in professionals. And of course, they are overworked. Then suicidal thoughts, lack of interest in personal hygiene. People are not taking bath, and personally, they are not brushing their teeth and all that. That is also there. Unexplained aches and pains are also there. Chronic physical pain complaints without apparent medical cause. Kabhi pair mein dard ho raha, sometimes they are having leg pain or hand pain or headaches or anything like this. Difficulty coping with stress. This is very, very common nowadays with the many adults, young or old adults, and even with the children who are appearing for different exams. Excessive guilt or shame, detachment from reality, inability to experience pleasure. That is also very, very common because people are distracted by so many things like gadgets, electronic gadgets, and so many things. Then disturbed thought patterns, they are confused, they can't think straight, hearing voices, that is a symptom of schizophrenia, compulsive behavior, social avoidance, excessive perfectionism. This is also one of the things which most of the adults are suffering from, because when they are in schools, they are supposed to be working on them, their studies, academics, and this results in later on excessive perfectionism. Intense fear, difficulty in managing emotions, changes in libido, that is significant changes in sexual desires or interests. Then there are sleep disturbance, of course, and decreased performances, that means decline in work, academics, or personal performances. So everyone experience some kind of mental health that can be unique. Not all individuals will be suffering from same symptoms. There are different symptoms. There may be few symptoms. There may be many symptoms. For that, if you feel that they are doing something, some of the symptoms which are more than normal, then you should always consult some mental health professional like psychiatrists and get the accurate diagnosis and treatment. And there are medicines also. And remember, always remember that this is not a stigma. You should be aware and get the problem sorted out with the help of doctors. Now, who are the people affected by mental issues? I hope I'm going on okay. Could you understand? Because my screen, I can't see it. It is full screen now.
Yes,
Yes,
Nupur,
ma'am, we
there is
can
also
understand.
a question. Yeah,
Okay.
there is also a question in chat box.
Okay.
There are two questions, in fact. Like, what is the difference between sleep apnea and insomnia? And then the second one is how to control violent anger.
Okay. So the sleep apnea is snoring. Okay. Sleep apnea is snoring, and insomnia is sleeplessness. Means a person can't sleep for whole night or longer period of night. And sleep apnea is when they sleep, they have sound coming out from their nose. That is also when I have seen in many people, when they are stressed out, they will have this problem, or when they are very, very tired and when they sleep, they will have this snoring problem. Now, when snoring comes, then it will be what to say, they will be having less of oxygen going in their brain. So sometimes what happens, they might, die also with this sleep apnea. That's why it is very necessary that you should take care of sleep apnea. And there are surgeries also, and there are medicines also to have you. And yet there are external instruments which you can, use it for that. And insomnia is sleeplessness when they can't sleep for whole night, even they are awake during the day also and at night also. That is called insomnia. Then
Thank you. Got it.
yes, yeah, I can't see the message. Let me check. What was the another message?
How to control violent anger? Like if someone starts slapping someone, or some like people, I've seen people forget their like some jhadu se maar diya, aisa kind of
That I'm
violent anger.
coming to. So chat. So we can, what is the difference between then how to combat violent anger? So that I'm coming to how to go through with that. So let me share the screen. Let's go on this journey again. I think so before I was not sharing the screen. So what are the people who are affected by mental issues? Who are the people, right? So people from all walks of life will be affected by poor mental health, because mental issues do not discriminate based on age, gender, ethnicity, or socioeconomic status. It can affect anyone and everyone, whoever have some kind of issues. Young adults, they suffer from this, and the pressure of academics, peer relationship, life transition can contribute to health challenges. Working professionals, most of the working professionals are suffering from this because of job insecurity and so many other factors. There are stress also and demand of so many expectations are there. And children and adolescents are also suffering from bullying, academic stress, family issues, hormonal changes. Then elderly individuals, they live in isolation, loss of loved ones, physical health issues can affect. Mental health in older adults are also seen. Then comes parents and caregivers, they of course, because they have their responsibilities and this lead to stress and burnout. Then individual with chronic illness, for example, cancer or some other issues like diabetes, BP, and when they are unable to cope with it or recovering from surgery, major surgeries or heart ailment, then they will definitely have some kind of mental issues. Then LGBTQ plus community discrimination is there, stigma is there, there are challenges for identity also. Then trauma survivors, which is very common in army personnel, and most of the people who suffer from some kind of trauma, some kind of abuse in their life, somewhere in their life events. Then substance abuse, people with substance abuse, substance use disorders always coexist, I have seen, with mental challenges, because most of the children who are, or adults who are, disheartened by the system, then they will start taking substance. Then military veterans, I have also told about army personnel who are on the border and they have seen some traumatic, experience some traumatic, they will be suffering from PTSD, that is post-traumatic disorder. Then refugees and displaced individuals, minorities and marginalized groups, that is those groups who are lesser in number in society, they will be suffering from some kind of mental problems. Now, how to support people with mental issues. There are many people who are suffering from this kind of issues. So what you have to do? You have to offer listening ear, hear them out, encourage communication, ask them to share, and then you build a trust that yes, you also agree with them. Now educate yourself, learn about mental health condition, whatever. That is why I am here and sharing so many things. So be patient, because these people who are suffering from mental issues, they will need a lot of patience from your end. And it takes time from recover from certain kind of mental problems. Respect their privacy. Never ever talk about their struggles and their whatever they are sharing with you. Then offer practical help. If they need help in cooking or help in some other issues, like going to office or school, help them. Avoid stigmatizing language. Like you say, Ari, he's very crazy, he's mad, or he's not in his mind. You should not use all those things. You should always encourage the person. Encourage professional help. If you feel that that person needs therapist, of course, you should tell them, okay, you go to the doctor. Stay connected, keep in touch with them. Respect their choices if they want to seek help or not to seek help. But you should always let them know that they need help. Engage in activities like something that they enjoy, walking, going to walk, or playing something. This will help to boost their mood. Then offer positive reinforcement. Acknowledge their effort, that they are getting better. They are working towards their development and their improvement. Avoid judging, never judge them. Promote self-care. Ask them to do their work, like cleaning themselves, changing clothes and all that. Be non-judgmental. So create safe space where they can share without fear of criticism. Then check in regularly, no emergency contacts, then show empathy and understanding and validate their feelings. Spend quality time, spend time together doing things that promote relaxation. Then encourage positive thinking, which we will be doing in our upcoming offline workshop, where we will be helping people to get over the negative thoughts and focus on the positive aspect of your life. So remember supporting someone with poor mental health. Your presence, compassion, and willingness should be there. Now, what are the remedies and strategies? For yourself, of course, practice self-care, maintain healthy lifestyle, connect with others, mindfulness and meditation, which we are going to do in our workshop, seek professional help. Of course, you should go to psychologist or psychiatrist and get yourself treated or diagnosed. Talk about your feelings, limit stress, reduce stress, set realistic goals. That means you should not say that I will be a billionaire. You said, okay, this much, how much I need, I can just earn it and get. That will help you to achieve your self-esteem. Accomplishment is there. Then engage in creative outlet, art, music, or dance, whatever you feel like you should. Then practice gratitude. That's what I said. Thank you in the beginning itself. So you have to be grateful to whatever you have got. Then limit alcohol and substance abuse. Challenge negative thought. You should always turn into positive, which we will be talking about more in our offline workshop. Stay active. Physical activity also is very helpful in your good mental health. Volunteer, go and help people. That is very important. And in COVID time, we have seen many communities who are helping each other, and it really helps people who are suffering from mental issues. Developing coping skills, learn healthy ways to cope with stress. For example, meditation or participating in group activities, etc., etc. So many things are there. Then practice relaxation techniques like what I used to get you to do, meditation, guided meditation. These are all relaxation techniques. So engage in support groups. Some groups like helping children, or a group or NGO where you can, see people are, working towards helping others. Limit screen time. This is the biggest issue. Reduce excessive screen time, that is using mobile, TV, or computer. And especially social media, this also affects your mental health. Practice acceptance, accept that it is okay to have bad days also. Then seek nature, spend some time with nature, go outside and take a walk in the park and admire the nature, or go for a holiday on a hill station, and definitely it will help you. So everyone's journey is better. Everyone's journey to better mental health is unique. Everyone have different journeys. So it is important that you should understand the person, how they are going through, and help them go through it. Now comes the therapeutic approach. Of course, there are some certain ways where you can get help, or a person who is suffering from some kind of mental health problem or issue, they can always take help. So there are different ways. CBT is there, cognitive behavioral therapy, which focuses on identifying challenging negative thought patterns and behaviors that contribute to mental health issues. It helps the individual to develop healthy coping strategies and more positive ways of thinking. Then there is mindfulness-based therapies, which we all over here, most of our trainers are helping you to do it. Then comes dialectical behavior therapy, where cognitive behavioral techniques with mindfulness practices are used. So both of them are combined, and then we regulate the emotions of people and improve the interpersonal skills. Psychodynamic therapy, this explores how unconscious thoughts and past experiences influence current feelings and behavior, where we use past life regressions. Then there is interpersonal therapy, which focuses on your relationship with your partners, or communication skills are also there. So this is where we improve the relationship issues with anyone, colleague or partners or anyone. Then acceptance and commitment therapy, where we ask them to accept whatever they are going through and without judgment, and commit to taking actions. Then exposure therapy. This is also like what you are going through. You are controlling those exposures. For example, a person is very much, afraid of something. Then what we do is we expose the person. Suppose he is very much afraid of fire. So we expose the person slowly and slowly by little exposure, and increase the exposure towards the fire element, so that he gets over his anxiety and other symptoms. Then family therapy, of course, to resolve all the conflicts among the family. Group therapy is there, which we are always do it, of course, online. Offline, we will be doing there on in one of our workshop, and there are many group therapies where in mental hospital, in some NGOs where we provide health professional provide group therapy. Art therapy is there. You draw whatever you want to, and you feel refreshed and you feel very, very relaxed. Music therapy is also similar to art therapy. If you are suffering, you can learn music and it will help you express. There was one patient of mine who is very good in, playing violin, and he is suffering from acute mental disorder. But when he plays violin, he's very, very relaxed. So this is one of the things. Then play therapy, which is almost used in for children. Schema therapy, where deep-rooted patterns are released. Then narrative therapy, where individual reframe their life story. Storytelling is one of the narrative therapy. Equine-assisted therapy involves interaction with horses, where individual builds confidence, communication skills, and emotional awareness. Then biofeedback therapy is also there. The neurofeedback therapy is there. So many things are there. Then diagnosis, how we diagnose. Psychiatrists are there, clinical psychologists are there, licensed psychiatric nurse practitioners are there, licensed professional counselors are there, clinical social workers and licensed marriage and family therapists are there. Clinical psychiatrists, pharmacists, primary care physicians, psychiatric nurse practitioners, they can all help you to diagnose. There are legal support also. Mental Health Care Act 2017, it helps you to, get legal help for the mental patients. Rights of mental patients are there. Mental Health Review Board is there. In India, I'm talking about India. NIMHANS, National Institute of Mental Health and Neuroscience, Bangalore, Karnataka. It is one of the known premier institution for mental issues and researches. Legal aid services, there are many NGOs, many government organization. Human Rights Commission is also there. Discharge procedure, which is very, very important when the person is admitted into a hospital. They have to, take care of certain things where government has laid down some process. Then there should be a consent also, capacity also, whenever you have to ask the patient whether they are, ready to go for a treatment or not. Right to information, community-based care is also there. Prohibition of electric shock, which is very, very important. Before they were given electric shock, now it is totally banned. Then there various legal advocates are assigned for the mental patients. Now, world legal support. International human rights are there. There are many organizations, United Nations, World Health Organization, which are helping these mental health issues also. National legislation are there in different countries. Mental health acts are also there. Protection from discrimination. This is very important, and it is being practiced in most of the countries. Some countries, they are not accepting this. Then legal aid services are there. Advanced directives are also there, where we can get some of the. So let's move on to more. There is so much is there. Then there is World Mental Health Day also. That is celebrated on October 10th annually, which raises awareness and reduces the stigma around the mental health. Global initiative for mental health advocacy is there. It promotes open conversation and well-being practices. Themes focus on mental health issues and care access. Activities include workshops, campaigns, seminars. What is the goal of these? This particular day is prioritize mental well-being as part of overall health. Conclusion is mental health is crucial for overall well-being. Awareness is key to recognizing and addressing issues. Stigma reduction is essential for seeking help. People are not really going to psychiatrists or psychologists for their mental issues. Accessible support should be there, and resources are there, but people are unaware of all that. Together, we can promote mental health globally and India also. So thank you very much for listening and for my long presentation. Now you can ask whatever questions you have, because I have made it very clear that mental health is very important, and each one of us have one family member or other who are suffering from some kind of mental ailment, and they are unable to go and seek help. So it is always, better to go and seek help. Even if they are giving medicine are there for only few months. It is not lifelong unless and until the ailment is serious one. So always take help. At least diagnosis done. And after diagnosis done, there are various ways where you can, help the patient to come out of their mental problems. So now we can open the session for question answers. Anyone who have any questions?
Actually, Manish ji has written heartfulness, relaxation, heartfulness, meditation, and he has written acceptance is the solution of 90% of our problems.
Yes.
And
So,
Udai has asked when people realize that they are having mental health issues.
yes. So what has happened that people are not accepting that the person has, and most of the parents, they can't accept that their child has a problem, right? I have seen many parents who have their children who are mentally ill, and they get them married. And what happens is the family suffers. So this is one of the biggest problem out here. And they are not, they are very careless in giving medicine. If there is acute mental issues, you should take medicine. Okay. So any of you have any questions so that I can answer it?
Hello.
Yes.
Hello. I have already mentioned in the chat how to control the violent anger. Sometimes when violent anger comes, later on we have to repent on it. Then how to control it?
The anger issue, when it becomes violent, is a serious issue. Okay. It is a very serious issue when the anger becomes, it turns into a violent behavior. The person starts throwing things, breaking things, or hitting others, right? In that case, you should always seek medical help. Plus, the person should be, if you are not going to seek, then you will not be able to why this person is having violent behavior. So when you diagnose the particular ailment, then only you will be able to sort it out. You will be able to get the remedy. Suppose it is just outbursts, then you can calm that person. You can ask the person to, go through some alternative healing therapy. But first get the diagnosis done. Why this is happening? Whether it is some trauma, whether it is some mental illness already. If this goes undiagnosed, you will not be able to cure the problem. The person will be angry due to many reasons. It can be stress, it can be PTSD, it can be schizophrenia, it can be phobia, it can be any multiple reasons of this outburst. So you have to first find out why this thing is happening and since when it is happening. So diagnosis is first and foremost in treating any of the mental issues, right? So extreme of any behavior, you should consult a professional, medical professional, so that you can have a better idea. Small things like stress, just stress or a little bit of outburst at one point of time can always be addressed by self-care, or you can take care. But when it becomes out of hand, when you are unable to control a person or a child, you should always go and consult the medical professional so that diagnosis can be done and you can address the problem more better. So any of you, any of the family member is suffering from this kind of behavior, Mr. Bajaj?
Myself, my wife, my son, my daughter, all have violent behavior sometime or other time. So later on we have to repent. It was not good. Nobody is actually my wife, my daughter, my son, and me have the different views, and nobody is agreeing to a particular point, and it creates a lot of nonsense, confusion, and irritation, anger. Uh, it is not good. Actually, I am taking a medicine also for the last 20 years, but it has not much impact. I had also counseling also, but basically nature is that irritation and anger.
Okay. For this, there might be multiple reasons. There might be dissatisfaction, and most of the time it might be stress also. And you need, with medicine, some counseling also, group counseling, family counseling, that is very important. So all four of you should go to a counselor or call the counselor at home and sit down and have a counseling session, at least few counseling session, You are taking medicine, that is okay, but with that you need counseling also. So when counseling is there, they will identify the pattern, how you are behaving, or a person in a family situation, how they are behaving, why they are behaving, what is irritating them, so that you can understand better and handle the situation in a better fashion. But you need someone from outside, from counselor or a psychologist, who can help you to understand what is going on in the family, which is creating such a different kind of uh, this thing atmosphere. Even you can consult someone online also. You can there are many psychologists. Where you are based? आप कहाँ
I'm
रहते
in
हैं?
Delhi.
हाँ,
दिल्ली में, दिल्ली दिल्ली दिल्ली
दिल्ली में
शालीमार बाग.
हाँ, दिल्ली में आपको बहुत सारे काउंसलर्स मिल जाएंगे, और वहाँ पे तो बहुत सारे मेंटल हॉस्पिटल्स भी हैं, काउंसलर्स भी हैं, साइकोलॉजिस्ट भी हैं. You can always consult them. You know, you need group therapy because all your family members are having similar kind of symptom. So that means something is there which is affecting. Maybe it can be financial problem. It can be stress related to career also. It can be, some expectation from each other, which is not normal. That might be the reason.
Right, madam, right.
You should even you can consult me also. I will guide you in some ways, but personal consultation is always better. But yes, you can consult me also, and I will understand the problem and tell you the solution also.
Okay, thank you.
You're welcome. Anyone else who have any questions?
Ma'am, Udayji has asked, are mental health issues genetic? In the chat.
Yes. Some mental issues are genetic. Like schizophrenia is genetic. Some mental issues are genetic. Most of them are not genetic. They are behavioral. Okay. तो most ADHD है, वो भी कई बार जेनेटिक होता है. बहुत सारे जो एलिमेंट्स हैं वो जेनेटिक नहीं होते, वो बिहेवियर की वजह से होते हैं या एनवायरमेंटल फैक्टर्स की वजह से होते हैं. जैसे कि आप जंग लड़ने जा रहे हो, वहां पे आपने किसी को मरते हुए देख लिया, आर्मी जाती है, पूरी आर्मी जाती है और लोगों का गला काट देते हैं, तो दैट इज नॉट नॉर्मल बिहेवियर. तो जब वो लौट के आते हैं तो उनको ट्रॉमा हो जाता है, तब वहां पे PTSD हो जाता है. तो कई बार आपने एक्सीडेंट देख लिया तो भी PTSD होता है. ये ऐसा नहीं है कि आर्मी के लोगों को ही होता है, पर वहां से पता चला कि PTSD भी होता है. लेकिन जो लोगों ने एक्सीडेंट देख लिया, मान लो सड़क पे किसी को देख लिया या अपने लव वन को मरते हुए देख लिया, उनको भी PTSD हो जाता है. तो वो क्या होता है, PTSD इज पोस्ट ट्रॉमेटिक डिसऑर्डर. तो उसमें क्या होता है कि आप वो जो देखते हो उससे आपको डर लगता है, या आप गुस्सा होते हो, या आप वायलेंट हो जाते हो, किसी भी तरह का आपको जो है प्रॉब्लम हो सकती है, मेंटल प्रॉब्लम, मेंटल सिम्टम्स हो सकते हैं. उसके लिए कई बार हमें थेरेपी के लिए जाना पड़ता है. बहुत सारी थेरेपीज मैंने बताई हैं, उसमें से वो जो थेरेपीज हैं वो सिर्फ मेडिकल प्रोफेशनल या साइकोलॉजिस्ट या साइकेट्रिस्ट ही बता सकता है कि आपको कौन सी थेरेपी, आपको कौन सी प्रॉब्लम है और कौन सी थेरेपी आपके लिए ठीक रहेगी. तब आप आगे बढ़ोगे और कौन सी दवा आपको लेनी, ये भी डॉक्टर ही बताएगा. ठीक है, तो आपको हमेशा जागरूक रहना है. यू हैव टू बी अवेयर ऑफ व्हाट प्रॉब्लम्स यू आर फेसिंग और योर लव्ड वन इज फेसिंग. इफ इट इज इन एक्सट्रीम, yes, you should go and consult a doctor. If it is in lower level, you can always use some kind of alternative therapy like meditation, mindfulness practices, or homeopathy, or some other alternative therapies that you can do and that you can use. But first and foremost is get your diagnosis done. जब तक आपका डायग्नोसिस नहीं होगा, जैसे कि आपको शरीर में प्रॉब्लम होती है वैसे माइंड में भी प्रॉब्लम होती है, आप डायग्नोसिस पहले बनाओ फिर उसके बाद इलाज करो तो आपको जरूर फायदा होगा। तो डायग्नोसिस इज वेरी इंपॉर्टेंट। चाहे आप छोटा स्ट्रेस हो, छोटा प्रॉब्लम हो, चाहे बड़ा प्रॉब्लम हो, आपको डायग्नोसिस पहले बनवाना ही पड़ेगा। आप एक बार चले जाओ, उसमें कोई डरने की बात नहीं है। आजकल तो सब चीजें अवेलेबल है, इवन ऑनलाइन भी आप कंसल्ट कर सकते हो। निमहांस हैज ऑनलाइन कंसल्टेशन फैसिलिटीज आल्सो। आप उसमें रजिस्टर करेंगे आप पोर्टल पे, तो वो आपको डॉक्टर्स के साथ अपॉइंटमेंट दे देते हैं। तो दुनिया मतलब इंडिया में जितना भी जगह है, सब लोग तो नहीं आ सकते निमहांस में, तो उन लोगों ने ऑनलाइन फैसिलिटी क्रिएट कर दिया। आप लोग वहां पे भी कंसल्ट कर सकते हो और वो लोग आपको बता देंगे कि आपको क्या प्रॉब्लम है, एंड दे विल प्रेस्क्राइब द मेडिसिन आल्सो, एंड इफ नीडेड दे विल कॉल यू। ऐसे भी होता है। तो निमहांस का भी आप देखिएगा, NIMHANS, ये ऑर्गेनाइजेशन बैंगलोर में है और इट इज वेरी गुड। दिल्ली में भी हॉस्पिटल्स हैं, मेंटल हॉस्पिटल्स हैं, और प्राइवेट भी हैं और गवर्नमेंट के भी हैं। तो आप वहां पे भी कंसल्ट कर सकते हैं पर गेट योर डायग्नोसिस डन। तो दीज आर सीरियस प्रॉब्लम। हाँ, लाइटर प्रॉब्लम्स जो होती हैं जैसे स्ट्रेस हो गया तो, और या थोड़े थोड़े ज्यादा आपको डिस्टर्बेंस हो गया, फियर थोड़ा सा है, आप अपने आप कोप कर सकते हो बाय यूजिंग माइंडफुलनेस टेक्निक और बाय यूजिंग ग्रुप थेरेपी, टॉकिंग टू अदर्स। दूसरों से बात करिए तो आपको पता चलेगा कि आपको जो प्रॉब्लम हो रही है उस बहुत ज्यादा अगर हो रही है तो उसको कम कैसे करें। तो बहुत बार बात करने से भी बहुत सारी चीजें सॉर्ट आउट हो जाती। मैंने जितनी चीजें बताई हैं, सारी चीजें एक आदमी में नहीं हो सकती। फ्यू सिम्टम्स विल बी देयर, थोड़े से सिम्टम्स हो सकते हैं। तो आप जाइए डॉक्टर से पता करिए कि हाँ आपको ये सिम्टम हो रहे हैं, इसकी वजह से हमारे जीवन पे असर पड़ रहा है, हमारे डे टू डे लिविंग पे असर पड़ रहा है, तब डॉक्टर के पास जाना। उससे पहले आप अपने आप को अवेयर करिए कि आपको है भी या प्रॉब्लम की नहीं। मैंने इतने सारे आप उसको यूज करिए, आप देखिए कि है, जाइए आप डॉक्टर के पास। पर पहले से ही मत डिसाइड करें मुझे ये प्रॉब्लम है, मैं तो पागल हो गया, ऐसा कुछ भी नहीं। यू आर हैविंग लिटिल बिट ऑफ सिम्टम व्हिच कैन बी ट्रीटेड। ठीक है? So anyone else have any other question?
Shivashi would like to ask a question.
Huh?
He had raised his hand, that's why I'm
asking. Mental issues are genetic, ये तो हो गया। किसने बोला है?
वो उदय सर का क्वेश्चन था, मेंटल हेल्थ इश्यूज जेनेटिक, जो कि अभी आपने आंसर किया, उन्होंने चैट पे लिखा था। मैम मैं पूछना चाहती हूँ जो केयर गिवर है, जो मेंटल हेल्थ इश्यूज है, जैसे मैं फैमिली जानती हूँ, मतलब ऑब्वियसली आई वोंट टेक नेम फॉर कॉन्फिडेंशियलिटी पर्पसेस, जिनकी वाइफ को 2011 से स्किज़ोफ्रेनिया चल रहा है, मतलब आता जाता, मतलब शी बिकम्स सो नॉर्मल ऑल्सो, देन शी स्टॉप्स टॉकिंग टू फैमिली मेंबर्स, वो अपने पीयर से भी बात करना बंद कर देती है, ससुराल में फिर भी कर देती है लिहाज के चक्कर में। तो मैम ये उनकी क्या हालत होती है, मतलब जो जिनके इश्यूज चल रहे हैं ऑलरेडी, उनको वो कैसे खुद को कैसे मतलब मेंटेन करें मेंटली और फिजिकली?
मेंटेन कर। हाँ, schizophrenia is one ailment which is genetic and which can be a combination of problems. तो डॉक्टर जब डायग्नोज करते हैं तो उसको उन्हीं के हिसाब से मेडिसिन देते हैं। तो जो मेडिसिन खा रहे हैं वो उनको लाइफ लॉन्ग खानी है। ओके, जब वो दवा बंद होगी तो उनको प्रॉब्लम होगी, उनको दवा खा के रहना है और उसका कोई और रिकॉर्स नहीं है। अगर वो शुरू होता है, शुरू में ही अगर आप इलाज कर देते हो तो दवा की डोसेस कम रहती है, लेकिन अगर आप बीच बीच में दवा बंद करोगे तो आपको डेफिनेटली रेजिस्टेंस हो जाता है, फिर दवा भी असर नहीं करती। आजकल तो बहुत अच्छी दवाएं आ गई हैं स्किज़ोफ्रेनिया की, जिससे कि साइड इफेक्ट्स कम होते हैं, और वो ऐसी दवाएं कि आपके स्किज़ोफ्रेनिया के जो भी सिम्टम्स हैं उसको मिनिमाइज करके रखती है, और आप अपना नौकरी भी करते रहते हो, पैसा भी कमाते हो, और सब तरह से अपनी नॉर्मल रूटीन में रहते हो। लेकिन अगर दवा बंद हुई है तो फिर डेफिनेटली ये ऊपर नीचे होगा ही होगा। एक्यूट जहाँ होता है वहाँ डोसेज बढ़ा दी जाती है और उसमें चेंजेस अप एंड डाउन रहेंगे। यहाँ पे पेशेंट को एक नॉर्मल सिचुएशन में, नॉर्मल एटमॉस्फेयर में ही रखना चाहिए जो भी स्किज़ोफ्रेनिया का पेशेंट है। अगर उसके एटमॉस्फेयर में चेंजेस होंगे, डेफिनेटली अप्स एंड डाउन्स होंगे। तो स्टेबल सिचुएशन रखना चाहिए, उनको केयर करना चाहिए, क्योंकि उनको सुध बुध ही नहीं होती है कि वो क्या कर। तो तुम्हारा जो केस है वो एक्यूट केस होगा, इसीलिए अप्स एंड डाउन ज्यादा हो रहे हैं, तो उनकी मेडिसिन का डोसेज बढ़ाना पड़ेगा। तो यू हैव टू कंसल्ट अ डॉक्टर टू इंक्रीज द डोसेज।
Mostly, what I would like to ask is जब हम जो केयर गिवर है, जो कॉन्स्टेंटली केयर गिविंग कर रहा है, या वो बुजुर्ग कर रहा है, चाहे वो एक यंग इंसान कर रहा है, उनके मेंटल हेल्थ इश्यू, तो उनके लिए आप क्या टिप्स देना चाहेंगे, तो जैसे स्पेशली फॉर द केयर
केयर
गिवर्स?
गिवर है, ही शुड प्रैक्टिस माइंडफुलनेस, और वो कंपैशनेट होगा ही होगा, क्योंकि तभी वो केयर कर रहा है। तो ही शुड बी कंपैशनेट एंड टाइम टू टाइम ही शुड टेक सम थेरेपी ऑल्सो, क्योंकि उनको भी जरूरत हो जाती है। कई बार क्या होता है कि दे ऑल्सो गिव अप, so they have to keep on getting motivation from the support system, family ho, friends ho, and they should also get some time off from their patient. तो रोटेशन में भी कर सकते हैं, कुछ दिन के लिए आप उनको हॉलीडे पे भेज दो तो थोड़ा सा उनका चेंज हो जाता है, then they will come back and they will be taking care of the patient in a renewed way. So this is very important for the caregivers कि आप उनको समझें, और उनकी जो मेंटल इश्यूज है वो इंक्रीज हो जाती है अगर वो एक ही तरह का काम करते हैं। मान लीजिए एक आदमी एक ही इंसान का केयर करता रहेगा तो वो भी वैसे ही होने लगता है, तो उसके लिए उनको ब्रेक देना जरूरी होता है। सो दे हैव टू बी वेरी यू कैन से कि आप उनको जो है समय दें, केयर गिवर को भी उतना ही समय दें जितना आप पेशेंट को दे रहे हैं, और केयर गिवर के साथ रोटेशन में शेयर करना चाहिए। That is very important. Family members should take some time off and give them time off so that they can, take care of own self also. तो ज्यादातर क्या होता है, अगर बेटा बीमार है तो माँ जो है लगी रहती है, तो माँ की मेंटल स्थिति जो है वो खराब हो जाती है, या हस्बैंड लगा रहता है अपनी वाइफ की केयर करने में, तो उसमें भी प्रॉब्लम होती है। तो उसमें क्या करना चाहिए, उसमें उनके लिए एक इंसान जो है उसको थोड़ा बोलो कि भाई आप हॉलीडे ले लो, थोड़ा ब्रेक ले लो, और हम उनकी केयर कर सकते हैं, लाइक दैट। सो इट इज इम्पोर्टेंट फॉर देम। यस,
ये सिजोफ्रेनिया और ये बाइपोलर में क्या फर्क है?
बाइपोलर में एक्सट्रीम्स होते हैं, और स्किज़ोफ्रेनिया जो है वो ब्रेन में चेंजेस होते हैं। बाइपोलर में एक्सट्रीम बिहेवियर्स, मतलब कभी वो बहुत खुश हो जाएगा, कभी वो बहुत ही दुखी हो जाएगा, तो ये बाइपोलर होता है। तो एक्सट्रीम ऑफ एनी बिहेवियर जो कि ज्यादा हो रहा है वो बाइपोलर है। स्किज़ोफ्रेनिया इज चेंजेस इन मेंटल पैटर्न, उसमें एक फ्लूइड होता है जो कि ब्रेन में जमा हो जाता है और जिसकी वजह से ये प्रॉब्लम्स होती है। तो वो जेनेटिक होता है या बाय बर्थ होता है, वो ट्रिगर हो जाता है मोस्टली एडोलेसेंस स्टेज में, और उसके बाद वो हमेशा ही रहता है। तो इसलिए जो स्किज़ोफ्रेनिक पेशेंट होते हैं वो ज्यादातर उनको मेडिसिन से और थेरेपी से उनको मेंटेन किया जाता है, और जो बाइपोलर है उनको कुछ समय के लिए मेडिसिन दे करके उनको जो है कंट्रोल करके, ठीक करके, और प्लस थेरेपी दे करके नॉर्मल पे लाया जा सकता है। तो दोनों अलग अलग तरह के डिजीजेस हैं, और बाइपोलर में लाइफ लॉन्ग मेडिसिन ज्यादातर नहीं खानी पड़ती है, बहुत सारे केसेस में चलती है, लेकिन कम केसेस ऐसे होते हैं जिसमें कि लाइफ लॉन्ग चलती है। स्किज़ोफ्रेनिया में लाइफ लॉन्ग मेडिसिन चलेगी ही चलेगी, क्योंकि ये कम नहीं होता है, ये बढ़ता ही है। और मेडिसिन से इसको कंट्रोल किया जाता है, इसका कोई इलाज नहीं है।
Okay, thank you very much, ma'am. Thank you very much.
बाइपोलर आजकल बहुत ज्यादा कॉमन हो गया है, एक्सट्रीम्स ऑफ बिहेवियर बिकॉज ऑफ लाइफस्टाइल इश्यूज एंड प्लस इतना ज्यादा स्ट्रेस हो गया, इसकी वजह से ये प्रॉब्लम हो गई है और बच्चों में
Okay.
बहुत ज्यादा हो जाता है।
Thank you very much.
यू वेलकम। और किसी को कोई क्वेश्चन? Anyone have any question? Sorry.
Thank you, Nupurji. You have explained so well. Almost everything. Like this is a growing problem. Like, and I think we need more such sessions so that we can be more light and more happier. You are on mute, Nupurji. You are on mute. You have to unmute.